Hello, everyone. This is spinal cord injury part 2. In the second part, what we are going to discuss is assessment. Assessment in a sense that not in a conventional sense, which include subjective, objective assessment plan, observation, palpation, and examination. Not in that format, but I would suggest that when we want to assess patients, rather than blindly following a given format, I think we should think that what are my goals of assessment. By assessing, what am I going to find out, and why I need this information, right? So from that perspective, if we start assessing, then at the end of assessment, we will really end up with something that are information that are really essential, and information that will guide our choice of intervention and how we further manage the patient. So these are all the goals of assessment that I've identified specific to spinal cord injury. The first goal is the determining level and type of injury. This is the first and foremost thing if you're managing patient with spinal cord injury, that you need to identify this. Secondly, establish baseline functional status. So what is the level of functional status we need to know, so that we can set goals from that baseline, how far the patient might move forward, if at all they have the potential to move forward. And also it will help us to evaluate to what extent the treatment that we are providing is actually helping them recover. That is, from baseline, how much they have recovered. And identifying complications is also an important goal, especially in spinal cord injury, because as most of you know, that there is a wide range of complications patient may develop. So we really have to identify if some complication has already developed, we need to look for it, or we also have to evaluate what are the likelihood that the patient may develop complications such as pressure sores or contractures or orthostatic hypotension, so on. The fourth goal of assessment is estimate the extent of recovery. Almost all patients ask us what would be the recovery. To be specific, they'll ask when will the patient will walk, or when will they recover, right? So to be able to answer these questions, we should have that as a goal. That is, at the end of assessment, you should be able to give an estimate of what is the likely recovery, and also evaluate outcomes. As I've said, in the baseline status, we can also evaluate outcomes. I just want to add one point with baseline functional status. It can also give us the initial severity level from a functional point of view, right? Not from a disease severity level, but a functional severity. So if we know all these information, this could really be very useful as a therapist to formulate a treatment plan, and also to set goals, and eventually to monitor how our treatments are working, right? These are all 6 goals of assessment that I've identified. In the subsequent slides, I will explain how we can evaluate, we can do assessment so that these goals are achieved. Right. So the first one, as I've said, determine level and type of injury. Most of you may already know, but using Asia scale is now across the globe, the common standard. So it's Asia scale. For those who are not familiar, it's basically sensory assessment and motor assessment. To be specific, what is we usually refer to in an academic setting like myotome assessment and dermatome assessment, but it is not just that, it's more than that, right? So, but this presentation is not about how to evaluate Asia scale or how to use Asia scale. Probably I'll think if I can put another video that specifically talks about how to do a Asia scale assessment. But how it helps is it can help us to identify what is the level of injury, and also more importantly, it can help us to identify whether the injury is complete or incomplete. This is one of the important goal. I'll explain later why that is important. So this is how, after identifying level of injury, this is the grade is there, A, B, C, D, E. A is the lowest level of grade, E is the highest level or the normal levels. And patients are sometimes, especially in incomplete, they may move from one level to another level, getting better. But in case of complete injury, it's more or less what they get at the initial stages. So these are all, this Asia scale, you can just Google it. You will have all this PDF that is explaining how to do this. And this slide tells about how you can determine whether the complete is, whether the injury, spinal cord injury is complete or incomplete. If it is incomplete, whether it is C, D, or E, right? If you want to get to know more, maybe you can pause the video here, just go through what is given up there. Right. So for identifying complete or incomplete spinal cord injury, as I said, it's very important for us to determine the prognosis, right? In Asia scale, an important item in it is to determine sacral sparing. Sacral sparing, whether the area that is supplied, sensory area that is the skin at the S4, S5 segment, whether it is present or not. If it is present, that is anal sensation and voluntary anal contraction, right? If it is present, it signifies that the spinal cord injury is incomplete. So why it is important to know if it's incomplete? Incomplete gives more hope for recovery. Again, in incomplete, there is different levels of recovery is there. Different levels of severity. But if there is incomplete, then it tells us that there may be a potential for recovery. And especially if it's tested in the early stage, in acute stage, it can help us to estimate that the patient, to what extent we can expect patient recovery. The next is to establish baseline status. This Spinal cord injury rehab project, a KT program that exists, is cireproject.com. It's a very useful if you're really working in a spinal cord injury setup, in the sense that they've given quite a lot of information. I've got these information from their website that tells us what are all the outcome measures you can use, and really lots of information is in there. So people who wants to read more extensively, I really recommend you to go to that website, and they have categorized information for professionals and patients and so on. So you can look for more information. So to establish functional status, first in functional status for self-care and daily living, you can use a Barthel index or FIM, and the Barthel index are slightly better. And you have a spinal cord injury specific functional measure also, which is spinal cord injury independence measure. You don't have to use all, you just go through it and see what is more useful depending upon your patient status. The other is for lower limb walking, lower limb functions. Previous one is overall functions, which includes upper limb too, right? These are all different tests you can use. 10-meter walk test. I mean, this is a recommended test. I really don't think that these walking test has much value because they are not really functional, but these are all the recommended tests. And if you're in early stage of your career, you should use these to know, understand what are the values of it. And walking index for spinal cord injury can be useful, I think. And the community reintegration assistive technology, we needed assessment for that too. And community reintegration really important. But I'm not very sure about the value of the scales that are given, because both these scales were developed in for a non-Indian context or Western context. So using it in our context, that can be really, there are quite a few items that are not really important. But what I want to emphasize is, even though the scales are not, some items are not relevant, I suggest, my point is, you have to take this construct, the outcome of community reintegration, as a really important goal. Probably you can have a goal attainment scaling having that. It's a very challenging goal to achieve, but I think if you're managing spinal cord and if you want to really evaluate rehabilitation is leading to outcome, we have to evaluate community reintegration. Assistive technology, very rarely we assess what is the value of it, and but yeah, we needed to evaluate them too. But I'm sorry, I really didn't go on into the components of the scale, but the construct, I think we have to start thinking to evaluate that aspects too. The next goal of assessment is to identify complications. I've just listed here some of the primary complication, major complication that might occur, but you must remember that while initial assessment, you need to look for, as I mentioned earlier, whether these complications have already developed, or you look for signs that whether to what extent it might develop, right? This presentation is not meant to be an in-depth presentation, so I'm not going into how we are going to evaluate and so on. But I'm sure most of the existing textbooks talks in detail, and I also encourage you to check out the spinal cord injury rehab project, the website which I previously told about. You can check that. They really have a lot of information, but just keep in mind these complications are really important for us, and it can also interfere with our treatment and its outcome. So it's important that we manage them, or we take that into account if we are not directly involved in managing it. Yeah, the next goal, and one of the goal of assessment, is that we should be able to estimate the extent of recovery. And almost all patients with spinal cord injury, first is when will I walk, or what will be the recovery? And clinically, we often respond to this question in a very vague manner, that you will recover if you take treatment regularly, you will recover, or maybe it will take few months, right? We tend to respond like that, but we need to understand that not all patients are going to recover walking or whatever they want, and we can't be giving a vague answer or just a sympathetic answer, don't worry, everything will be all right, or patronizing answer. We shouldn't be giving that. As a professional, we have to look at their condition, and based upon the current evidence that is available, we should be able to estimate. Especially if it is complete spinal cord injury, we really have a lot of information that tells us that what is the likely functions they may achieve given the level of injury, right? So that is, we should be able to say. So we need to. So I'm going to give you a very brief idea about different levels of injury and what is the likely recovery they can achieve. And this is for complete injury only. For incomplete injuries, is because it's incomplete, it depending upon whether it's level D or C, right? The recovery might be really good or not so good. So in incomplete spinal cord injury, determining recovery is not, it's more challenging, but still, if it is Asia scale D, means you really have a good chance of recovering walking, right? So incomplete lesion, this is what the available data suggests, that Asia scale impairment level A at their first examination, they have a very few chances of getting better below the level. So that is the complete lesion, right? So if it is incomplete, then you have B, C, D, and E. E is normal, so we don't really want to go into that. So if we are talking incomplete injury, that is B, C, D, what is the likely recovery in terms of walking specifically? So what the current data suggests that if the patient is at the level B, that is those with motor complete but sensory incomplete, they show some recovery, and they might move to C or D. But this is again if it is measured at the early level. But if it's a late, like after 6 months, the patient is still at the B, we can't really think that they will move on to C or D. But there is in the early stage, if it is there, that is during acute stage, they are likely to go to C or D depending upon the extent of damage. So the overall recovery of ambulation, that is by walking, is considered to be 33% for B. For level C, they really have a better prognosis for walking than B. And for D, most people recover better at the 1 year post-injury. So the as far as if it's incomplete, walking recovery is better for C and D. And for A, it's basically complete lesion. We can't expect much. So that's what we could tell patients, that is after evaluating their ASIA scale and categorizing their impairment level. Right. So the next couple of slides I'm going to talk about expected level of functions in complete injury. I remember, as I said, if it's complete injury, there is very little recovery we can expect. So depending upon the level, what are the likely functional status that they will achieve? This is more or less clear, and this is based upon the current data exist and the recovery at the end of first year, right? According to the level of injury I'm going to give, right? If it is at C1 and C4 levels complete injury, this is really very, very unfortunate, and there is very little function we can expect. Patients will be mostly ventilator support. They're completely dependent. If you want to read everything in this slide, you can pause and read, because again, I didn't meant this to be a very extensive presentation. So those who need information, more information, you can pause and read what is given. And at the C5 level, one of the major addition to it is they have some form of elbow flexion muscle strength. So what it can help them to move with a wheelchair. They can use a joystick. Very comparatively, it is better. But with elbow flexion, you can have, many people tend to use transfer activity. This can be helpful, but again, wheelchair dependent. At C6 level, they have additional wrist extension and a hand grip is possible. So a bit of hand function, in terms of eating and other things, they can manage fairly well, and to a greater extent, dressing of upper body. So C6 is critical for having some form of upper limb function. C7 and C8, you have additional finger flexion strength, and which means that here the daily living activities independent, it is given, it is referring to upper limb function in terms of dressing and so on, not at the lower limb. So it doesn't mean that they really get better. T1 to T12 level. So because there is the trunk levels are affected. Yeah, whether it's that is from T1 to T11, there is no levels that is given, because that means that it really doesn't make much difference. They all are having more or less similar function. But if the level is T11 and T12, the biggest advantage is that they really be able to move out of wheelchair and walk, have a home ambulation, that they can walk to some extent within home with the help of a crutch or a walker. That's the major recovery that you can see. But going out of home, they still need a wheelchair. L1 and L2 can be the lowest level, and patient can be walking with a walking device, and to some extent they might be able to go out. And there are other activities of daily living, including personal hygiene, they will be fairly dependent. L3, L4, mostly at the lowest part, they will have, they might be able to have some form of dorsiflexion in knee, and they can ambulate with a crutch. And you may have seen some patients with spinal column going out, right? So this is to a greater extent L3, L4, and anything below is they will be fairly independent with some remaining problems. So as you can see, at a different level, the walking is really challenging. That is why spinal cord injury can be a very devastating for a patient's life, because the regaining ambulation is really challenging, especially if it is a complete injury. Right. So that's all I've listed the goals of assessment and each go and how we can determine all of it. Right. I hope you have had it gives some clarity. Spinal cord injury, a very, very vast topic. So these videos that I'm making is meant to give you an overall brief idea of what are the things that you need to. Obviously, you need to learn more in depth of all the aspects that I've spoken about. And I also suggest you to I've put another video specifically on using orthosis prescription. Very interesting video. It's a very short video, and that's going to be really, very useful. So I recommend you all to uh, go and have a look at that video. I'll also put a link in the description. Um, we will meet again with the part 3 of spinal cord injury, where I will talk about various interventions that can be treatment that can be given for a patient with spinal cord injury. Thank you very much for watching.